Thank you for joining the COVID-19 Public Health Action webinar, Utilizing Data to Drive Reopening Decisions. My name is Steph Moyer, and I'm the Community Initiatives and Training Coordinator for the Hawaii Public Health Institute. Before we get started, I just want to go over some Zoom housekeeping. For all questions, please utilize the chat box or questions and answers box located at the bottom of your screen. For our COVID series, we will not be offering any continuing education credits. And lastly, all webinars are recorded and will be available on the Hawaii Public Health Training Hui's YouTube channel. Without further ado, I would like to introduce you to our presenters for today. Our first presenter is Nick Redding. Nick is the Executive Director of the Hawai'i Data Collaborative, a nonprofit organization working to improve the well-being of families and communities in Hawaii by enabling data-driven collaborations that guide critical decisions for addressing our most pressing challenges. He received a PhD in Social and Organizational Psychology from Columbia University, a Master of Science in Psychology from Eastern Washington University, and a Bachelor of Science degree in Psychology from Washington State University. Our next speaker will be Mitchell Rosenfeld. Mitch has been serving as Program Manager for Contact Tracing for the City and County of Honolulu since September. Mitch assembled and now manages the contact tracing team for all city and county employees in conjunction with the State Department of Health. His background is as an emergency medicine physician, having attended in the emergency departments at the Queens Medical Center, Kapi'olani Hospital for Women and Children, and Palimomi Medical Center, which he performed for 20 years. Prior to his career in emergency medicine, he worked as a software engineer in the aerospace field, most recently as the Jet Propulsion Laboratory. His public health experience results from his BS and MS degrees in public health from UCLA and UH Manoa, respectively, in which he focused on acute epidemiology. Mitch was born in Los Angeles, California, and has resided intermittently in Hawaii since 1977 for nearly 30 years. And last but not least, we have Hiro Toya. Hiro has been serving as the Director of the Department of Emergency Management at the City and County of Honolulu since October 2018. Hiro works with staff to coordinate emergency management activities with other city departments, as well as state, federal, and non-governmental partners, both during day-to-day operations and during large-scale emergencies. Hiro functions as the director of the city's Emergency Operations Center and has experience with numerous real-world activations to include tsunamis, tropical cyclones, flooding, structural and wildfires, and high-profile planned events. Hiro previously worked as a senior planner at the Hawaii State Department of Health, where he worked with state, local, and federal emergency managers and the private sector. Hiro is a graduate of the Georgia Institute of Technology with a bachelor's degree in Industrial and Systems Engineering, and also received a Master's of Public Health from Tulane University. Hiro was born in Yokohama, Japan, and at the age of 10 moved with his family to the United States. Now it's my honor to turn it over to Nick.
Aloha, everybody. Thanks, Stephanie, so much for this great introduction. It's great to be with all of you. Let me share my screen. Okay. So as Stephanie said, the Hawai'i Data Collaborative, we're working to improve the well-being of families and communities in Hawaii by enabling data-driven collaborations that guide how we address our most critical challenges. We didn't start there, and what we started off is as a project of the Hawaii Leadership Forum, really focused on just understanding what data was available to us in our philanthropic work to understand how we might make a difference in data-driven ways. So we actually started working on an index of well-being for Hawaii. And while the index project kind of changed into something else, what we did find in the process of building that is that there's lots of data available to all of us working to address complex challenges in the state that's sitting with different agencies, census data, and other kinds of sources. that oftentimes is challenging to get to, either because of the format of the data or where it's stored, or the region schemes that the data is captured in, et cetera. And so what we decided to do is take a lot of what we learned in building that index and start to make work to make that publicly available. We proposed a scheme for well-being that captures 10 domains of well-being. We put that data that we found into that scheme, and then we developed and transformed the data into common region schemes and made that available on our website at hawaiidata.org. And we did that because we felt it was important to, think about accessibility of data as more than is the data available? Can I get to it? That's certainly a part of it, but it's also can I get to it in a way that allows me to start to gain insight? Can I get to multiple data sources in a way that allows me to put them together in meaningful ways? Do I need a data team to do data work, or can I work with the data more directly? Those are all challenges that we aimed to address in building out this platform. We did that work mostly in 2019. And as we launched the site and our website, we started to ask ourselves the natural question, which is, why are we doing this? What is the reason behind this? And we knew our own motivations, which was, to better understand how we could do our work in more data-driven ways, either understanding where we could be most helpful, but also being able to assess the impact of the work we're doing. But as we started to share that, we realized, well, that we're sharing this because we've heard a similar story from many of our partners and other stakeholders that we're working with, is they oftentimes feel that they don't have the data they need to guide the important decisions that they're making. And so that's what brought us into 2020, is that realization that this is something in its own right that is worth working on. How can we start to elevate important data for tackling our most pressing challenges? Now, I don't think I have to make a strong argument here that COVID-19 represents one of the most pressing challenges we're faced with here in the state, and that's true for communities across the globe. It became clear early on for us and many of our partners that managing COVID-19 over the long term was going to be necessarily a community effort. There was almost immediately an unprecedented demand for timely data to help us understand what was going on. And this was data about COVID itself, data about our readiness to respond to COVID, data about our economy, data about how households are doing, household well-being, et cetera. And we started to ask, what's it going to take to get to a level of data transparency, a data openness, data availability that's going to work for all of us that are going to be working on this challenge in the days, months, and potentially years ahead. One thing we did early on was we started to work to take the data that was coming mostly out of DOH regarding the day-to-day evolution of the spread of the virus here. And we started to think about how can we make that, how can we transform that into something that provides insight about where things might be headed, something that would help us kind of start to plan and understand what we were seeing in the day-to-day trends of the numbers. And what I have here is a screenshot of what that's evolved into today. Some way to allow everybody to have a place to both get access to the data, but also kind of start to see it in context and what it might mean for what's coming in the days ahead. Something else we did is we started to have conversations with others working on the challenge and try to understand a little better what are they faced with, and whether it's people like Hiro and Mitch with City and County of Honolulu, or those at Haima who are doing the planning, or business leaders, private sector community trying to figure out to help. All of these questions started to come to us about how do we plan, how do we think about month to month where how the virus might be spreading and what impact that's having on community. How can we plan for ways to reopen our economy that balance public safety and things of that sort. And so we started to have conversations around, well, what's the data that we currently have? And then given the range of questions that we're hearing coming from many different stakeholders in the community working on this challenge, we started to think and expand, what indicators are actually really going to be important for us. to understand and be able to track day to day, week to week as we move forward. And so, we found, of course, that we have the new cases that we get every day, and it's still reported every day, and most of the media sources provide updates every day on that, and we hear from DOH and others daily how we're doing in new cases. We had a sense of hospitalizations and fatalities, things of that sort, travel-related cases. But what we were starting to learn from local conversations and what other communities were able to do across the nation and globally, we realized there were opportunities to start to explore how could we get at indicators that are leading in nature. How do we understand before what we see today, what might be coming? So when we know about new cases and the new cases we see today, we know something was happening 10 to 14 days, maybe a little longer before today, that was increasing or decreasing the spread. So how can we start to get at that? And seeing that was a function both of understanding the patterns of transmission and also our readiness as a community to respond and prevent that transmission. We also really think it's important to contextualize lagging indicators, which is that's really something that's very important to track and understand, because we need to make sure that our health systems are ready. But that represents the almost too late scenario, which is what the result of the new cases were 2 or 3 weeks out. So we really thought it was important to start to think about how we can expand the indicators that are available to us. It's at this point, it's important for me to point out that I'm not a public health expert myself. And nobody on my team is as well. We weren't, like most of us, well, actually, speaking to this group, most of you are equipped for this, but in the discussions we've been having, there's so many people who hadn't thought much about epidemiology, hadn't thought about as much about public health science and things like that until COVID hit. And so while we found ourselves situated and placed to be helpful and be able to start to be responsive to the questions that were coming from our partners and others in the community we were working with, we realized very early on that one critical role that we could play is start to help to elevate the extent to which local experts, such as those on the call today, would be able to bring to these really important discussions, and be able to both use and work with the local data in ways that are meaningful to the local context, but also help us translate the science, the research, what we're finding on the mainland and globally, and help us apply that locally. So we started to work in the very early stages of the formation of something called HIPAM, the Hawaii Pandemic Applied Modeling Work Group, to begin to explore how can we bring together local public health experts, epidemiologists, data scientists, et cetera, and bring that collective wisdom and knowledge together in ways that we could elevate important insights to those who are making critical decisions about managing COVID and mitigating the spread of COVID going forward. So this has been an ongoing effort. It's alive and well today. Maybe some of you on the call are familiar with it. But one of the, it's led by Victoria Fan, who is a researcher at UH, and also Thomas Lee, who at the time was the epidemiologist for HIEMA. And what we've been able to do is to stand up a website that takes COVID data and then translates it from an expert perspective. So we have Hawaii forecasts, so localized forecasts of likely spread of the virus, active cases, hospitalizations, fatalities, et cetera. That draws from the models that are used globally, the SEER models and things like that, but then adapted to local context and local data. That's one output from that, and that's the model that you see on Department of Health's data dashboard. And then we've also started a Thursday webinar series where the experts come together and they take on a specific topic. I think last week was immunizations and what that might look like here, and what we should be thinking about as immunizations become a possibility sometime next year. And so it's something that we're very excited about, and it represents the intersection of our interest in data and indicators and the availability of those, with the importance of making sure experts are helping us make best use of that data and understand that data and interpret that data in appropriate ways. Lastly, something that we've become involved in the last couple of months is something called COVID POW. COVID POW comes out of the Hawaii House Select Committee on COVID-19, the Hawaii COVID Collaborative there. And what was recognized in launching this effort was that in addition to good data, expert-driven understandings and analysis, we also need really solid platforms for communication. We need to have something where all sorts of audiences that are affected by COVID, which is everybody, right? Everybody from people in the community to business leaders to nonprofit leaders, policymakers, et cetera, having a reliable source of information that helps us understand what's happening with COVID. It can be overwhelming to try to find that for ourselves. And the data, dashboards, there's plenty of dashboards, lots of data, lots of different media accounts of what's going on, studies, et cetera. Finding a way to synthesize that into something that has meaning without overwhelming and helps people to take action in the ways that they can. So we're working with COVID POW and making sure that they have the data they need, and we can help them prioritize the data that's most useful for the audiences they communicate with. And we support the dashboard that they have and data widgets. And then we've also recently been able to connect the work of HIPAM to COVID POW to ensure that some of the best stuff that's coming out of the Hawaii, of the HIPAM group is able to be communicated more broadly with the robust work that COVID POW is doing. So in reflecting on where we were, Hawai'i Data Collaborative, where we were in 2019 and the value that we saw in making data available in ways that more stakeholders can make use of that data for addressing the decisions they need to make around the challenges they're confronted with or the challenges they choose to take on and work with. We really feel that the COVID crisis has simply amplified that need, and it's created an urgency that all of us feel in ways that we might not have felt before. Again, I know I'm speaking to a group that is probably more aware of this and has been aware of this than others, but we're really struck by just how important it is and has been and continues to be for us to have the data we need to confront what we're challenged with. We have COVID today, we've had challenges in the past, we'll have challenges ahead in the future. And what we say is that this really might be the opportunity to start to explore how we can take data seriously for addressing these challenges. And I say take data seriously, I don't imply that we don't. As individuals, as organizations, as communities, I think we do take data seriously, but it means something different to take data seriously as a society and think about how does data flow between those who have it and those that don't, et cetera, for addressing these challenges. In Hawaii today, we have a very rich social infrastructure for shared problem solving, which is really important. But arguably it might not be sufficient, that oftentimes it's the stories and the data and how those come together that are most important. And what feeds that and allows for that is open data where we need it, when we need it. One of the challenges today is that so much of the data we need relies upon departments and agencies that are already stretched so thin in the work that they're doing. They're responding to the urgencies of the moment and also being asked to do very different things about the data they're sharing. Now is not the time to be revamping our data practices and data sharing, and yet we kind of have to because of what we need. And so starting to think about the longer term of this, which is both how do we get better at data for the crisis, but also get better at data during peacetime, so to speak, or non-crisis time, so that when the next crisis comes, when the next need comes, that the data flows are there for us for the next challenge that comes. We think about data in terms of its transparency, the ability for all of us to see what's happening so that we can start to talk about the same things and then start to arrive at similar conclusions that we can discuss and talk about ways forward. We think this is important for accountability, and the natural place to go with data for accountability is holding leaders accountable. Certainly allows for that, but I think it's also an opportunity to hold ourselves and each other accountable for all that we aim to do and bring a richness to how we think about taking up our problems, which mobilizes effective action. Data mobilizing effective action is critically important to the work that we do. Lastly, what I'll say is I think the way that we get there is at 3 levels. One is working on our data capacities. What data do we have? Where is the data? How do we get to it? What tools do we have to work with it, et cetera? Critically important. That's the infrastructure. That's how the data flows and becomes available to us in the ways that we need it. But critically important are the networks, the ways in which those who have data, those who need data, those who have expertise relevant to the questions at hand are able to come together in meaningful collaborative platforms to really create generative research products that guide the work that would go forward. And lastly, I think the hardest work, of course, is data culture. How does everything that I've just talked about and all the values I think that a lot of us have around data and what data can do for our decision making, how do we start to make that normal? How do we start to make that the default? How do we start to make that the expectation that we all have of each other, is that data comes alongside and is right there to guide and support the critical decisions that we make. That is all. Thank you very much. I think now I'll pass it on to Hiro and Mitch.
All right, thank you, Nick. So my name is Hiro Toi. I'm the Director of Emergency Management for the City and County of Honolulu. And really thank you to the Hawaii Public Health Institute for this opportunity. It's really important for us to be transparent throughout all this. And I hope that by communicating with you all that we get further public understanding of what it is that we're trying to accomplish here. So of course, ultimately our goal is to have healthy people here, a healthy community, and a healthy economy. We want everything to be back to being normal. But I'll paraphrase what the new head of HTA said yesterday during a press conference, Mr. John DeVries. He said, what we have now is an imperfect scenario with imperfect people. And what we have in common is aloha for our state and for our community and for each other. And so really that's where the city team is coming from. That's where the state folks are coming from in trying to develop a workable plan as we go into the future here. So if you'll bear with us, Mitch and I will tag team this talk, and we don't have any slides, but I'll be doing some screen sharing throughout. So just to give a little bit of an overview, the way we see this, there's 3 prongs to the COVID response here. And I think most of you are thinking, okay, is it testing, contact tracing, and quarantine isolation? That's not exactly what I'm talking about. So the 3 prongs as we see it is individual and community response, and that includes businesses. The second one is the public health and healthcare response. So that's what people think of in terms of the COVID response, but that's one component. And the third component is the government mitigation actions, which are these restrictions and rules that we have. So that's what we're here to talk to you about today, is that third prong of our response here. And so going into this, of course, we went into a second stay-at-home order August 25th. Even going into it, we knew that in order to come out of this, that we needed to create something that's clear and transparent. And like Nick talked about, using data that's readily available to the public. And to give the public and the businesses some expectation of what's to come in the future. So we created this tier system that's based on 2 simple metrics, 7-day moving average of case counts and 7-day moving average of test positivity rate. We knew that if we made it too nuanced, there's a number of metrics out there that we could have used. But then ultimately, if we made it too nuanced, then it becomes the judgment of the chief executive, and people don't know what to expect. So we try to simplify this as much as possible. So to explain kind of some of the backstory of how we got here, I'm gonna turn it over to Mitch right now.
Thanks, Hiro. Essentially what I'm gonna do is just discuss that backstory a little bit. And that really is the story of when we first saw COVID-19 here in Hawaii. And that takes us back to February, late February, when the State Department of Health first became aware of a traveler who did test positive for COVID-19 from Japan. We started to notice an increase in the case counts in February, which continued into March. And on March 23rd, we had our first stay-at-home order. The stay-at-home order appeared to be working very effectively, and by April 19th, actually, we were back down to single-digit case counts, and so that was a very optimistic sign. We started to let down our guard a little bit. I think in May 15th is when we started to relax some of those restrictions, and that continued on through June, and then even into July, and through July 4th, we started to notice once again a rising of the daily case counts, which did become concerning. I think by August 13th, we had over 350 cases in Hawaii, and by August 15th, we had over 4,200 total cases of COVID-19 in Hawaii, whereas just a month earlier, we had some 973 cases. So it was a pretty significant jump, significant enough where we attracted the attention of the federal government. The general surgeon did come out to the islands and brought 90,000 tests for surge testing. On August 27th, the mayor initiated second stay-at-home order, and surge testing ensued. The surge testing continued through the end of August and into September. We got up to, I think, even up to 9,000 tests on one particular day. And we started to see some definite results and some real benefit to our efforts. And ultimately, bringing us up to September 24th, that's when we were able to enter Tier 1 of our reopening strategy. And I'll turn it back to Hiro to discuss a little bit more about what evolved, and it's back to you, Hiro. Thanks.
Thanks, Mitch. So, coming out of that second stay-at-home order, we knew that we had to have clear guidance to everybody, to the community, to individuals, and to businesses. But even prior to that, we knew that we didn't want to repeat the same mistakes of the past. The dramatic increase in cases that we saw and how we were able to respond to it, and also our limitation in the response, really triggered the city to take a number of actions in order to prepare us for the second reopening. So there was significant investments that went into to the public health response to work with the Department of Health to build additional capabilities. So you might have heard that the city's actually contracted with a firm to assist in DOH's contact tracing capabilities. Dr. Rosenfeld was brought on to ramp up the city's own contact tracing capabilities for our workforce. We increased the isolation quarantine capacity at hotels. So we have contracts established with a couple of area hotels to make sure that if anybody who isn't able to safely quarantine or isolate at home, they can quickly be brought into a hotel property so that they can quarantine and isolate there, and to receive support while they're there. In addition to that, we had a number of communities that were disproportionately impacted. So one of the things that we did for the city side was to hire a Pacific Islander liaison to make sure that we're plugged into the community and communicating and understanding what the situation is and what the needs are and how we can best work with the community to come out of this pandemic. So really, before even coming out of the second stay-at-home order and developing the new reopening framework, we knew that we had to develop these additional capabilities. So Mitch talked about one of those, which was the testing side. So in addition to the Surgeon General's surge test program, we have contracts in place with the 7 FQHCs, the federally qualified health centers here on Oahu, to do COVID testing. We've also worked with the medical school here to establish a clinical laboratory to do COVID testing there as well. So again, it's not just about developing the new rules, but developing capabilities so that we come out of this lockdown, and in the event that we start to see an increase in cases, that we are able to address those adequately. So really what the process was, in addition to establishing those capabilities, going into it, to the lockdown, we knew that we had to come up with a good plan. So we were discussing what we need to do even prior to issuing the second stay-at-home order. But as we were in it for 4 weeks. As the end of those 4 weeks approached, we really started to ramp up our effort to do this in collaboration And really that's the key word here. I think you might have seen in the news that DOH in the past had been reluctant to accept assistance from other entities. Well, that's not the DOH that we've been working with recently. They've been really open to working with us. I talked about some of the capabilities that we developed, but as we were developing this reopening framework, we did so in coordination with the Department of Health. We had Dr. Sarah Campbell, the Deputy State Epidemiologist, and Dr. Janet Behrman from the Kauai District Health Office. I think many of you are aware, the way DOH is structured here, each of the neighbor islands, they have what's called a district health office with a district health officer that's in charge of public health operations on behalf of the state, on behalf of DOH for that particular county. Oahu, unfortunately, does not have a district health officer. I know Dr. Char is trying to change that, but so that's why we were working with the Deputy State Epidemiologist and Dr. Behrman from Kauai. So as you guys know, Kauai has been very successful in their COVID mitigation and response efforts. And so we thought she would be the perfect person to guide us through this, and she was. So in addition to the Department of Health, we work with the Attorney General, General Hara, who is the incident commander for the COVID response for the state of Hawaii, and a representative from the governor's office. So this was constant communication between all parties. In fact, we actually spent 2 full weekends because during the workday, it's kind of hard for all of us because of all the meetings and stuff to carve out dedicated time to work on this. So Labor Day weekend and all 3 days and the following weekend, both days. So basically a total of 5 weekend days we spent on Zoom, just like we are right now. Hammering through this whole thing. So what we did first, and let me do a quick screen share, and we haven't actually released this publicly, but I think this is an appropriate audience to share this with. We first got together and established some guiding principles as we're developing our our reopening framework. So first and foremost is that that this new plan was going to be informed by the best available information from science, public health, and epidemiology, but understanding that there's limitation to that. You guys are all aware, like the information changes, new things come out, and we have to adapt to that. But we do the best we can with the information that's available to us. The second thing was that the health of the community and the health of the economy are inseparable. So if we don't have a healthy community, we don't have healthy people here, then we can't have a healthy economy, and vice versa. Don't repeat the mistakes of the past, both of our own and other jurisdictions. As Mitch mentioned, when we reopened the first time, we kind of went into a sprint from like late April through basically April 25th through June 19th was our reopening period, in which we opened parks, and on the other end, on June 19th, we opened up bars. So we knew that how we did it was not the way to do it moving forward. So the next one is that we wanted to create a society that we can live with, even at the highest level of restriction. So what we have, and I'll do the screen share of our reopening framework, but tier 1 is intended to be the most restrictive that we want to be. There is a possibility that we have to issue another stay-at-home order, but the intent is that this is as strict as we're ever going to get, because we know that stay-at-home orders are not sustainable for any of us, mentally, physically, economically. It's just too damaging. So we want to avoid that at all costs. So at the highest level of restriction, we recognize the possibility that we might have to stay there for a while. Knock on wood, we're looking good right now. We might be able to move into tier 2 in the next week and change. But we wanted to make it so that even at the highest level of restriction, it's a society that we can all live with. But we need to account for other changes that's going to happen. School reopening, flu season coming up, tourism reopening. For the city, there's going to be a change of administration come January. So we want to make sure that we're accounting for all those as we develop this tiered system. Related to that is that the plan stands the test of time. We want it to be as static as possible, but recognizing that some adjustments might need to be made as new science becomes available, situation changes. So we do want to make sure that we stay very well structured, but have some recognition that change might be necessary. The next one's really important. This is really one of the prongs of our COVID response. The mitigation action, restrictions, and rules from government is only one component of this whole thing. So what we want to do is create structure, but give people and businesses some agency and not micromanage too much about how things are being done. We want to empower people and provide enough guidance so that people can adopt safe practices. But at the same time, we need to recognize how people are going to behave in real life, right? So anticipate how people will behave. We saw that some of the issues we saw with the first reopening was gatherings continue to happen. And in particular, the message that outdoor is safer is important, and it's true. But at the same time, that kind of went to an extreme, and we had like way too large this at beach parks and other places. So we're anticipating how people might behave in real life and created our reopening plan accordingly. We also needed to give people hope for the future, right? Because we've been at this for so long, with going back to February. So we wanted to make sure that there's a plan for the future and be transparent about what to expect. This next one, number 10, is really important. We structured it so that we give a realistic chance of bringing the disease under control, even without a vaccine. So our intent is that as we reopen, we can continue to keep the case counts and the test positivity rate trending down, and that we can get to tier 4 without a vaccine being available. That was the intent of this plan. And finally, this is another important point, is that the rules are equitable, rational, and easily understood by the public. So those are some of the guiding principles that we set at the beginning of this whole effort. And then what we did was basically set the baseline at tier 1, that this is the most restrictive that we're going to be. And as we progress through the tiers, we lift some of those restrictions. So I'll turn it back over to Mitch to talk about how the plan is structured.
Thanks, Hiro. And again, those guiding principles are essentially the foundation for our reopening plan and the tier structure, which was actually similar to a tier structure that was utilized in California with some modifications made. As Hiro said, tier 1 is essentially reflective of the worst case scenario. And the metrics we're using throughout all the tiers are the running 7-day average of the daily case count and the running 7-day average of the positivity rate. And tier 1 is defined by a case count of greater than 100 new cases a day and a positivity rate of greater than 5%. And what it reflects is a really severe level of community spread, which we recognize was putting significant strains on both the public health system, which is attempting to test, trace, and isolate, as well as our healthcare system attempting to provide ICU beds and ventilators. And that made up tier 1, which again, as Hiro said, was our kind of worst case scenario, and for which we're already seeing some benefits. We've been in it since September 24th, and we've continued to see improvements in both of those two metrics that we look at. Tier 2 is still a substantial spread in the community. We're looking at daily case counts between 50 and 100 and a positivity rate between 2.5 and 5%. And we're still seeing substantial spread in the community, but we, at that level, the public health system is at least adequately testing, tracing, and quarantining or isolating. And the healthcare system itself seems to be able to manage at that level. Tier 3 is when we're experiencing only a moderate amount of spread in the community. There we're looking at daily case counts between 20 and 49 and positivity rates between 1% and 2.49%. And again, at that level, with the moderate spread in the community, we expect the public health system to be able to fully and easily perform its testing, tracing, and isolation, as well as the healthcare system to accommodate ICU beds and ventilators. And ultimately, tier 4, which is our goal, is when we expect to see low spread in the community. with daily case counts averaging below 20 per day and a positivity rate below 1%. And at that level, we expect the public health system and the healthcare systems will be able to function without any strain and fully and efficiently. Each tier level has been broken into 4 weeks minimum. It certainly could be longer. We'd like to keep them all to 4 weeks if we can. And if, with community effort and everyone's participation, we're hoping to be able to proceed right through to tier 4 in hopefully 4-week increments. But we'll have to see. The idea being that when we enter a new tier with more relaxed restrictions, we need to give at least 14 days, which is what has been determined up till now is to be the time in which 95% of all people who've been exposed to COVID-19 would become symptomatic. Within that first 14 days, the first 2 weeks of that tier, we have the relaxed restrictions. And then for the next 2 weeks, what we want to do is be able to monitor how efficiently and how effectively we're carrying out those restrictions, with the hopes that if we can maintain the next tier's level of metrics, so going from tier 1 to tier 2 would be holding at 50 to 100 daily cases and 2.5 to 5% positivity rate. If we could maintain that for 2 weeks continuously, that will allow us then to proceed into tier 2, and that same strategy will hopefully carry us into tier 4. That's pretty much how I would summarize the 4 tiers that we've got, and I think right now we're all doing very well, and we're just relying on, again, community participation and everyone making the sacrifice in order to allow us to proceed to the ultimate tier 4. Thanks, Sarah.
Thanks, Mitch. And actually doing a screen share of our website. This is the live website, oneoahu.org / reopening strategy. So, the sort of the rules of engagement are at the top. So as Mitch mentioned, we have to remain in each tier for at least 4 weeks. And essentially that's 2 full incubation periods to ensure that we're accounting for the changes that we're seeing in the transmission as a result of us opening up into that tier. So we made it easy for the public to track as much as possible. We have some social media presence on this as well, both from my department and from the mayor's office. We got this, hopefully no copyright infringement from Domino's Pizza. It's kind of like their pizza tracker thing. So on a week-by-week basis, we're doing a assessment. Essentially, because we opened on a Thursday, we're going to Thursday to Wednesday metric. So these numbers you see, we'll post them on Thursday of every week, but essentially you can see those by about noon on Wednesday when DOH releases this. So if you go to the DOH website at health.hawaii.gov and go to their dashboard, you can see the 7-day average counts for both the cases and test positivity rate by county. So as you can see here for the first week, this is really coming out of our stay-at-home order. 1 week later, we were at 93 cases a week for the previous 7 days and 4% positivity rate. What's really promising for us is the fact that we entered tier 1, and in the second week, we actually had a drop in the case counts and test positivity rate. So last week, Thursday, as of last week, Wednesday afternoon, we had these numbers. So indications are so far so good. We'll have similar figures. The case count was a little bit higher today than before, but we're still well under the tier 1 threshold. So if this keeps up in 1 more week, we can enter tier 2. So here's the chart. So Mitch went over this. So for tier 1, if the case counts are greater than 100 or test positivity rate is greater than 5%, then we stay in tier 1 or revert back to tier 1 if you're in a different tier. And then tier 2, if we stay in 50 to 100 range and 2.5 to 5%, then we stay there. So in order for us to get to tier 3, this is going to be the tough one. We've been sort of hovering over like the 70 to 80 range of cases, but we're going to have to drop those case counts down to under 50 per day. So we got a little bit of work to do, especially with the visitor economy re-energizing. So again, this is one component of the response, the government mitigation rules/restrictions, but it really takes the entire effort of the community, individuals, businesses, as well as the Department of Health. This isn't just about contact tracing and testing. There's so many different components to this that we need to address. So that's how that works. Hopefully this is, the chart is pretty self-explanatory, but I'll take the example of the restaurants. And by the way, anywhere there's an underline on this webpage, these are hyperlinks. So you can get additional details on each one of these sectors if you click on them. What you see this chart here is very much like a bird's eye view of what to expect across the tiers, across all these different sectors. But you can see, like, you click on restaurants here, and pardon us while the page loads, you can get additional information about that sector. I pull up the example of restaurants, and I think this is one thing important to talk about. We've been transparent that the Department of Health actually had some hesitation about having indoor dining at Tier 1. So this is one area where Mayor recognized the importance of this industry. It's tied to so many different things, from the farms to the transportation, fishing, and all the agricultural stuff, from the entire supply chain, that it has this huge economic impact. And what we talked about earlier on, one of the guiding principles is that the health of the economy and the health of the people are tied together. So we got to be healthy on the COVID side, make sure that we don't have any spikes in cases. But if we have, if our economy keeps going downhill, well, that's going to be really bad for our community, and it's bad for our health as well. Poverty is really bad for people's health. So in recognition of that, we made a compromise here, and we were trying to be very transparent about that fact. So the compromise we had for restaurants in Tier 1 was that we are limiting the dining, indoor dining, to same household members only. So these are people that are presumably already close contacts with each other, and limiting the capacity. And as we progress through the tiers, we make more allowances. So on the website, there's more details, particularly important for the those that are working in the industry, that they review these rules, and we try to make them as readily as available as possible. This is the language that's included in the mayor's orders, but those tend to be super dense. So we try to make this a lot more accessible by linking it through our website here. So I think I'm kind of gone over time a little bit here. So I'll stop there. And really, what I want to continue to emphasize is that this is a whole community effort. And as much as people are tired of hearing it, it's like we're all in this together. And from the government side, we really do want everything to be back open and everything to be back to normal. But we're trying to do this as safely as we can. And again, it's really coming from a place of having aloha for the state and for our community and for each other. So thank you for your time.
Thank you so much to all three of you for your presentations. Just as a reminder, if you folks have any questions, please feel free to drop them into the chat box or the Q&A box. So first question we have is, can you touch on or share your thoughts about the ever-evolving way of calculating and reporting positivity rate? And how can we advocate for increased data transparency and improved contextualization, especially as we move into potentially testing visitors locally?
Okay, I can take a stab at that first. So the metrics, the metric that we use for our purposes is published by Department of Health. And what they're using is the denominator is the total PCR tests performed. Another way to calculate it is by unique individuals, which was a piece of data that was reported earlier on by Department of Health, but it becomes confusing because if I were to have gotten tested in April, June, July, and August, well, I'm only counted one time in that. So it doesn't really reflect the true positivity rate of the tests that are being conducted. So the data that we're using is based on the total PCR test that's counted. It is a challenging metric to use because it's not, there's a lot of context to it. So as more rapid tests become available, if a bunch of people are doing antigen tests and that's screening out people, and only those that are testing positive on the antigen test are getting a confirmatory PCR, then your positivity rate is going to go way up. So it is a dynamic figure, and we recognize that. So really for us, the more important metric on our reopening is the case counts, because that ties back with everything. You can do a prediction of, based on case counts, how the healthcare system is going to be stressed a few days down, or a week or two down the line. We can predict how much that's going to stress the contact tracing system. We can predict how that's going to stress our isolation quarantine hotel capacity. So a good question on the test positivity rate. But for us, we're using the numbers as reported by DOH, which is the total tests performed. Nick?
Yeah, and I'll just add and just say that regarding the transparency side of that, the DOH has been evolving the extent to which they're sharing the details of that data. And so both in their HawaiiCovid19.com, the visualization that covers that, they've now made it possible to download a CSV file of the data that drives that. And I know that that's continuing to evolve to get more specific in the columns, different ways of breaking down positive test, negative test, testing counters, et cetera. For the specificity that different audiences might have. So,
Thank you. The next question is, how can state and county agencies improve their data collection efforts? What are common challenges that you've encountered in trying to acquire data from state and county?
is that one for me to start, since county is in the room with us?
Go ahead, Nick.
I mean, I think what I would say is, for us, what we've been thinking about is trying to translate what the community is asking about with what's possible, reasonable from the side of those who are tasked, with collecting that data and stewarding that data. And that's something we're continuing to try to evolve. And what's really clear on the side of the state and counties especially is, it's two things at once, right? It's both managing the ongoing crisis and exploring how to share data at a frequency that's unprecedented, right? Like the demand for daily, weekly data across all these things and being responsive to something that we're continuing to understand better, right? It's not like COVID is well documented and well understood such that there were predetermined a priori of the pandemic. What are the metrics that should be tracked and how are they useful to different decision-making scenarios and things like that? So that's where we're most interested is what are the trade-offs of all that? How do we, help those who need the data understand that what they might be able to do with what they have and what's reasonable to expect from the agencies. And then for the agencies, like what's the translation of that and where do they need help and all those things, realizing that first and foremost, they're tasked with doing the safety stuff, contact tracing and isolation and all that stuff, and the data then in service of that. But it's a balance. So I don't want to frame it in terms of difficulties, but more just trying to kind of level set, get a sense of the landscape, and then see, where can we start to evolve what data is available to all of us, as we move forward.
And if I may, just the only thing I would add to that is that, of course, this all comes down to our ability to test. And with adequate testing, I think we generate much more reliable data. When our resources are limited and we can't adequately test, the data becomes that much more reliable, so that much less reliable. And so again, I think resources are going to be key.
Yeah, and just add one more thing. Most of the public health data belongs to the Department of Health. It's not coming from the city and county. I think one area of interest for the public in regards to data from the city is how we're spending our money. So I'll do a quick screen share. We also make this publicly available as well. This is a dashboard of how the city and county is expending our $387 million in CARES Act that's been allotted to us. So you can also access this information by going to the oneoahu.org page.
Thank you. Next question, I believe will be for Hiro, is what happens to the tier system with the rise in tourists that is expected to begin this week? Will the criteria for the tiers count in introduced cases?
Oh, that's a very good question. So this is something that we've been discussing internally, and it's a little bit nuanced. So I hopefully got enough time to explain here. So yes, with the resumption of tourism, we do expect that there's this strong potential for a rise in cases. Hopefully I don't eat my words. I'm personally more concerned about the resumption of additional economic activity related to tourism. So workers going back who had been off for many months, probably going to be really glad to see each other, handshake, hug, kiss. Let's go get lunch together. Maybe let's go pauhana. So there's a potential for additional close contacts being introduced. So that's one area of concern. And of course, as the question suggests, there's potential for cases being introduced here. So what would happen with the cases if visitors are here and they get sick and they go in to get a diagnostic test and that they come back positive? Well, that's going to count towards the county of diagnosis. So if they're on Oahu, that individual is going to be included in our count. And that makes sense, right? Because that person's here, they got diagnosed here, and that disease burden belongs to this community. The nuanced piece of this is because people are getting tested pre-departure 72 hours before, if they get tested and they don't have obviously if they get tested and they're positive, they shouldn't be traveling, right? But if they don't have their results, they still have the option of traveling to Hawaii, come into the state and go into quarantine until their results are available. Now, we're hoping that most people who are feeling sick aren't going to be traveling, but it's possible that some asymptomatic people come through. They're waiting for their results in their hotel in Waikiki, and then boom, notification comes in, they're positive. Well, in terms of the data flow, the testing entity and the ordering physician has no obligation to report that result to the State of Hawaii Department of Health. That result's going to get reported to wherever that test occurred. So more than likely, now I say more than likely because it's possible that if the public health system is working really smoothly across state lines and that whatever the home state of that individual is quickly able to notify the Hawaii DOH, that those guys get added onto here. But more than likely, individuals who got tested pre-travel, got their positive result in Hawaii, they're not going to be counted towards our case count. But in terms of how we're applying the tiers and our metrics, we did account for the resumption of tourism. We were expecting that to happen, and when we issued this. So our intent is to leave the structure as is.
Thank you. I'm going to try and squeeze in one more question before we wrap it up. So final question is, do you believe that Hawaii can use data to address health and racial equity? Which groups or sectors should be involved in these efforts?
I'd be happy to address that, but in 2 minutes, it's hard to, except for to say yes. I would agree with that, and I think we've learned a lot about how important that is and how we can do better. And so that's something that we're advocating for, and some things that we're writing about and thinking about, and how we can engage with data in the years to come.
Thank you. As I mentioned, in the interest of time, we are going to wrap it up now. So I do want to give a big mahalo to Nick, Mitch, and Hiro for being our guests today. I want to thank all of you out there on Zoom for attending today as well, and to thank the Hi-Fi staff behind the scenes. We are transitioning our public health action webinars to once a month now. So our next webinar will be on Wednesday, November 18th, again from 1 to 2 p.m. The topic will be success stories from the community during the time of COVID-19. Again, mahalo for joining us. Be well, be safe, and we hope to see you in November. Aloha.
Aloha. Thank you, everybody.